So hello friends, today we will be continuing the discussion on Salmonella. Yeah, we have already discussed something about their lab diagnosis, their clinical features, the clinical difference between the two, enteric fever and non-enteric fever. And we said how to learn that. We said H2S, xylose and arabinose we have to write first. Then we write from the vertical side, we write S typhi, S paratyphi A, S paratyphi B. And then we say tick, tick, cross, 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 tick, 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 tick. Clear? This is what was the yesterday I told you how to remember. Okay, means H2S is produced by staphy, xylose is utilized by staphy, but arabinose is not utilized. Okay, and we said that if we have greater than 1 week, if greater than 1 week patient is coming, we should go for antibody detection. But today is an important topic. I want to tell you how we diagnose clinically the Salmonella. The test we use in the hospital for detecting this typhoid and enteric fever is Vidal test. Vidal test. Okay, guys. So Vidal test, what we are doing is, excuse me. See, in Vidal test, the principle is that first you should listen. The principle is that we have to go for antigen. We have to see. We are using some antigens. What we are doing? We are using some antigens. Okay. We are using O antigen and we are using H antigen. Fine. We are using O antigen, we are using H antigen. Okay. Now with these antigens, I will be detecting some antibodies. I will be detecting some antibodies. You know, we today in the laboratory, we are using what? Slide Vidal test. What? Slide Vidal test. I should write like this. See, I have TO. Okay. That is O antigen. Then I have TH. Paratyphi. Paratyphi AH. Paratyphi BH. Can we understand these four terms? What I mean to say by these four? Yeah? Can we understand these four? What I mean by this? Yeah. I hope you are understanding that we are writing the four organisms so that I can check the. Okay. Now, sir, why I don't have AO? Why I don't write AO? I have write H antigen of this. Why I not write AO? Isn't it a question? You should have a question, sir. Why I am not taking AO? The reason we are not taking AO and BO is because their antibodies, O antigens, the antibodies, O antibodies will react. They will have a cross reactivity to this also. Are we able to understand? For example, I put an antibody O. This O can react with this also and this also. You will not be getting the specific result. Will not be getting the specific result. Okay. Is it clear? Okay. What was the difference first? Do we remember the O antigen and H antigen? O antigen was a somatic antigen. H antigen was a flagellar antigen. Where is O antigen present? Lipopolysaccharide, sir. Lipopolysaccharide. We yesterday said what is H flagellar antigen? Therefore, it should be made up of protein dash. If it is a flagellar antigen, it should be made up of protein dash flagellin, isn't it? Fine. Now, out of these, what are you using? Are you using the S antigen in the Vidal test? Sorry, O antigen of S typhi? Yes, sir. We are using the antigen of S typhi. But H antigen of what you can use? You can use H antigen of paratyphi A, paratyphi B, and also S typhi. We can use antigens. If you are not able to listen to understand my words, you have to go to the video one. Yesterday that's why I made so much time on that video. Okay, friends. So you have to it's usual. O antigen. In Vidal test, we are using which antigen? O antigen of what? S typhi. Do we remember yesterday's table? Guys, do we remember yesterday's table? S typhi, S paratyphi A, S paratyphi B. Do we remember that table? Yeah. Yes. So it's all that same thing what we learned yesterday. Okay. Now see, in H antigen of what you can use in the Vidal test. H antigen in Vidal test, what do you use? You can use H antigen of S typhi, H antigen of S typhi A, paratyphi A, H antigen of H paratyphi, S paratyphi B. So let me write for you. So in Vidal test for O antigen, what O antigens we are using? You are using O antigen of S typhi. You are using the O antigens of S typhi. Sir, why we are not using the O antigens of paratyphi A and paratyphi B? Sir, why you are not writing paratyphi AO? Why you are not writing paratyphi BO? Because antigens cross react. These antigens cross react with this typhi. You will not be getting any normal result. You will be confused. You will be having, there may be false positive cases, false negative cases. So you have to understand that we have, if I use O antibodies of these, what if I use O antibodies of these, they will cross react to TO, typhi. Is it clear? So we don't have AO and BO. Why? Because they will cross react. Do you know cross react? Like if I have, do we remember the M antigen? Do we remember the M antigen of a bacteria? What was the name of the bacteria who was cross reacting in the myocardial tissue? Was streptococcus. Streptococcus. What streptococcus? So many streptococcus, guys. This is not a microbiological answer. Full name you should say. Pyogenes, streptococcus pyogenes. So what was happening in that? In that you were producing antibody. The body was producing antibodies to destroy what? M antigen. To destroy the M antigen of that, isn't it? M protein of that bacteria. Once you have an infection, the body will make antibodies and it will try to destroy. Okay. Now, this M antigen it was having similar characteristics to myocardial cell of the body, the heart. What happened? My body produced antibodies. My body was producing antibodies. Every foreign antigen, you will be having an antibody. Now, this foreign antibody, what it did is it had to react with M antigen. But since it saw myocardial tissue also having the same structure, M, it said, okay, this is also the bacteria. Let us kill him. This is cross reactivity. He does not know it is hard or it is, he just knows if I see M antigen, I have to destroy. I have to produce M antibodies and kill it. Is it clear, friends? Same is happening. Once I'm using this test, what happens? I'm not able to use AOBO because once I start using this, it can also cross react with TO. It can also cross react with TO. You won't be getting to know which infection is it. Is it a paratyphi infection or is it a typhi infection? Is it clear, friends? I have made it easy. Simple concept I have given you. So tell me, is it clear? Okay. Now, what is special about O antigen? O antigen, if I write something is less immunogenic, if I say something is less immunogenic, it means it will drive the immune system response at a lower pace, at a lower level. It will drive our immune system response. If I put O antigen in my body, my immune system will not become so much immunogenic. It will slowly, it is less immunogenic, will not cause that much adverse, that titer in the body. But once I put H antigen is more immunogenic. O antigen is less immunogenic. H antigen is more immunogenic. Now tell me one thing, how many lines is H having? H has how many lines? H has how many lines, guys? 3 lines. H has 3 strokes. O has 1 stroke. Who should be more immunogenic? Who should be more immunogenic? H antigen should be more immunogenic. Why, sir? Because this is how I remember. Okay, clear? Now, what is special about O antigen also? Guys, O antibody, let me tell you, Okay, let us make like this. What antibodies do we make? What is the name of the antibody if I have a O antigen? If I have an O antigen, what antibodies we make? What antibodies we make, guys? Say O antibodies. Why to wait for this much? The name becomes opposite, same. Okay, tell me. If I have Sunana antigen, I will be making dash antibodies. If I have a name Sunana antigen, I'll be making Sunana antibodies. Are we clear? If we have Sana antigen, we will be making Sana antibodies. If we have Amara antigen, we will be making Amara antibodies. If we have bad people antigen, we will be making bad people antibodies, isn't it? Bad people antigens in the classroom, we will be making bad people antibodies. Okay. Now you are able to understand. So if I have O antigen, I will be making O antibodies. So this O antibodies, the O antibodies, once you bring them together, O antigen and O antibody, you went to the market and you told this laboratory guy who is selling all these antibodies, you told him, please give me O antibody. Okay, O antibody. Please give me O antigen. Okay, give me O antigen. And I took these two packets back to my room and then I started reacting them together. O antigen, O antibody. What did I see? I saw there was some chalk. I made some chalk. There was clumping. Agglutination was happening. But it was happening very slowly. Why? Dash. Agglutination. Do you know the process of agglutination? Means you are clumping something. Once I mix something, then you get this agglutination. I have taught you, I think. Agglutination reaction is happening. I will be teaching this you in blood grouping, okay? Blood grouping I will be teaching you. So O antigen and its antibody will react. They will definitely react, but very slowly. Fine. Okay, friends. So but if you see, if I went to the market now and I am taking now H antigen, this was about O and O. O antigen, O antibody, guys. Now I went to the market and I bought the H antigen and H antibodies. I bought the H antigen and antibodies. Once I reacted them back home, I went to home and then I reacted them at home. They did not form any chalky clumps. They formed loose, fluffy clumps. Loose, fluffy clumps. Loose, fluffy clumps. Fine. And whether it will take agglutination, the process of agglutination, will it be rapid or slow in case of H antigen antibody reaction? In case of H antibody antigen reaction, will it be rapid or it will be slow? It will be rapid. Very nice. It will be rapid. Okay. It will be rapid. Fine. Did you understood now? Now can I say, let me say it for you. Let me make a generalization. Sir, you said O antigen, O antibodies, they are reacting together. Can I say O antibodies of typhi, O antibodies of paratyphi B, O antibodies of paratyphi A, these all are equal. Whether you take one or you take two or you take three, you take one of them, any one of them, they will cross react. They are doing one and the same thing. So that means these are non-specific. Now I get the generalization after understanding. Otherwise, you start mugging up at home. Non-specific, non-specific, non-specific. No, first understand why non-specific. H antigen is dash. H antigen is dash. Specific. H antigen specific. Is it clear? Now, is it is it prudent? Is it wise to use the AH, BH, or is it wise to use AOBO while I am diagnosing a Vidal test? This one or two, group 1 or group 2. I should be using group 2. I should be using group 2. Sorry, I should be using group 1. Okay, I should be using group 1. Fine. Have you understood this, friends? Have you understood this, everyone? Everyone, friends, everyone should answer me. Who is not able to understand? Let me kill him or her. Who is not able to understand? Understood? Okay. Now I tell you what is the diagnosis. Okay. Now let us talk about the interpretation of adult test. Interpretation. Now, so guys, interpretation, for example, I get a result. The result is, it is written that the patient's TO has risen and also his TH antibodies have risen. They're up. Definitely a simple diagnosis, sir. He is having an enteric fever because of S. typhi infection, isn't it? Isn't he having a fever with S. typhi? You have to choose from that group. Isn't he having S. typhi infection? Clear? Because H, yes sir, specific to that. O, yes sir, because O antigen and H antigen you have to take. Fine. Fine. So it is an infection with S. typhi. So it's an S. typhi enteric fever. Are we clear? There are so less people answering, guys. Okay, we will give you more examples so that you can understand what sir means. Okay, if I have increased TO and increased AH antibodies dash, sir, TO AH, huh? AH, A, sir, first we have to go to paratyphy. Oh sir, it has also A antigen. Yes, it should be an infection with S. paratyphi. S. paratyphi enteric fever. Now I do one thing. I say TO. Now you will be telling me BHAB, 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 guys. TO, BHAB, BH antibodies. It is S. paratyphi B, S. paratyphi B infection, S. paratyphi B infection. Okay. I have increased TO. I have increased TO antibodies only. It means I have a recent infection. It means I have a recent infection, and it can be either due to S. paratyphi A or S. paratyphi B. S. paratyphi A or S. paratyphi or even S. typhi. Clear? I don't think people are responding. There is some doubt, I think. It is so much clear. If you have listened to my lectures, then it will be easy. Now again, okay. I have increase in TH. Okay, you will tell me now. Don't use your books. Don't use your books. Please close them. Listen to the lecture with open ears. Then go to home and open the book. It will not be useful if you are listening to class and also watching the book. You will never remember everything, anything. Increase in the TH antibodies. Huh? Increase in the TH? Sir, TH antibodies. That means, yeah, they have destroyed everything and now I have less. So it means convalescent stage. It's a convalescent stage. Convalescent, what is convalescent stage? Convalescence means recovery phase. The patient is recovering. Or it is an anamnestic reaction. What is anamnestic reaction? Amara will tell me. What is anamnestic response? What is anamnestic response? Yes, guys. Anyone? Anamnestic response? An anamnestic response means once you give a particular antigen to your body, once you put any sort of an infection or any antigen to your body, there will be a rapid reappearance of antibodies. Are we clear? That means if this is happening, that means you should be previously affected with this infection. That means you should be previously been affected with this infection. Your immune system should have been exposed to that infection previously. That means it's the base of a memory response. What a beautiful subject. It should be based on a memory response. So on the basis of memory response, that rapid reappearance of the antibodies to that particular antigen, as if the body has been previously exposed to that antigen, is called as an amnestic response. An amnestic response. Is it clear? Okay. Increase in TH, increase in AH, increase in BH, antibodies, dash. What is the interpretation? And you have to give me reasons. Yes. What is the answer? Everyone should answer. Then I will tell right or wrong. It is a post-TAB vaccination. We have vaccinated this person. Okay. Can I call it a mixed response? Can I call it a mixed response? Can I call this case a mixed response? If yes, then why? If no, then not. It's not a mixed response, guys. It's not a mixed. Put a big cross on yourself. If it would have been mixed, then O antigens would also be increased. No. It's a post-TAB vaccination. It's a post-TAB vaccination. Convalescence, we have told you, TH antibodies. Don't take. You haven't read immunology, so don't make it in that way. It's different. Whatever you are writing, immunologically, it's not correct. Okay, friends. Principles of immunology are not being satisfied. Okay. Now we have a famous. Now, did you understood the Vidal test? Did you understood the Vidal test? There is nothing to explain. I don't think there is anything to explain in this test because you yourself got it. You have to just play with the O antigen and H antigen. That's it. Just have to play with these two. Who is having this antigen, who is having these antibodies right now will be that infection. Principle is that. Is it clear? Remember this word. O antigen and H antigen. Fine. Clear? Okay. So let us write a mnemonic. The famous mnemonic is, there is a famous mnemonic that is called BASU. What is BASU? BASU is used to remember at what period I have to check what. BASU we are using for how to know which sample you have to take. So in the first week you have to take what? In the first week we take what? Dash. In the first week we take blood. In the second week we take, everyone remembers this. I think every doctor is remembering this like this. Okay. Second week, antibody detection. Second week you will go for antibody detection. Third week you will go for stool. Fourth week you will go for urine culture. Is it clear? Stool culture. Is it clear? Is it clear how to remember which week to take? Okay. Okay. I hope you are understanding this. Yeah. This bacteria, he is living in the gallbladder. Gallbladder is his favorite place. Okay. It is in the carrier people. Let me tell you about carrier people. In the carrier people, the people who are carriers for this, in carrier people, it is present in what? It is in the carrier. If it is a urinary carrier, then you will say it is in the kidneys. Okay, that way I can tell you. Carrier, if you say carrier state, I will say yes, carrier, urinary carrier. Is it clear? You said any way, anything to the renal system. Yes, carrier state is to the urinary system. If you say me fecal carrier, I will say gallbladder. So fecal carrier is more. So we have two carriers. We have fecal carrier. We have urinary carrier. Fecal carrier, most common. That means in the GB, gallbladder, they will be dividing. They will be dividing in the gallbladder, and you know gallbladder puts its secretion in the duodenum, goes into the large bowel, and then is excreted in the feces. That's why we are taking feces for carrier state, or even we are taking bile, okay, bile for this purpose. Urinary carrier means they are dividing in the kidneys, and then these bacilli are put into the urine. Clear? Now is it clear? So in that way it is affected. Carrier state. Okay. There was another thing, by the way, I remember from your, there is a parasite actually. His name is Schistosoma hematobium. Schistosoma hematobium. This causes bladder carcinoma, if more, no, Schistosoma hematobium. Okay. So this infection can also be associated with this schistosoma hematobium. Infection can be also associated with this. Okay, so remember that also. So any abnormality, any any disorder with the urinary tract, it will be also associated with. No, it will be also. I'm saying also, not it's always also associated with schistosoma hematobium infection. It is affecting the bladder. Okay, fine. Okay, so how will you diagnose the carriers? You will go for a bile culture or you will go for a stool culture. Okay, now tell me what is the titer value? What titer value? What titer of antibodies can you tell me that the person is infected? What titer? What titer value should I take that I will say, okay, if it is greater than this, then it will cause this, then it is he is having this infection. What is the titer? Do you understand the titer? Titer. You know that amount of those antibodies which have peaked. It's not that we are taking the titer. The titer depends on the place the person is coming from. It depends on the endemicity. Endemic. Is it endemic? Is in that area typhoid is more common? Okay, that is where you make the mistake in the exam. They will put another option. What they will write? They will write it depends on the endemicity. You directly go for 200, 100 titer, isn't it? 200 greater than 200 H is there, then I will take it significant. Greater than O antigen, greater than 100, I will take it, isn't it? It's not that. You have to remember, it depends on the endemicity of the place the person is coming from. You have to remember this and then diagnose it. Because maybe in endemic places, I'll be taking some small titer as significant. I'll be taking as small response as significant. So it's not like that. That's why I told you things are not strict. It's based on common sense. So I can't take Harrison value right now here. Harrison or Davidson value. If Harrison is giving us a value, because he's giving the value on the Western data. He's giving the value on the Western data. And if I am from any other country, South Africa, I will be taking the value of South Africa only, because in South Africa I will see what is the curve of this disease. What is the data about this disease? So remember, the titers which you are taking is based on endemicity. What is the endemic status of that place where the person is coming from? Fine. So that now we will say which titer. We will say if H antigen is greater than, usually we are taking if H antigen is greater than 200, significant. And if O antigen is greater than 100, significant. Clear? Clear? Okay. So agglutinin titer greater than 200, agglutinin titer greater than 100. Fine. There can be also some false positive, false negative cases, which we will be learning, in the infectious disease part. But from the microbiology point of view, I think it's okay to remember this much. Okay. Okay, let us go for treatment. So how will you treat the enteric fever? Treatment of enteric fever. Treatment of enteric fever, guys. Treatment is the drug of choice is ceftriaxone. Drug of choice is ceftriaxone. Okay. Whether the patient is, if you want to give an empirical therapy, ceftriaxone. Do you know empirical therapy? Do we know about empirical therapy, guys? Or resistance therapy, resistance cases? Yeah, empirical means I don't know right now who has caused this, but I am giving it to cover that. Okay. Now I got a susceptibility report. I got a susceptibility report. Do you know susceptibility report? You can call it, it's a antibiogram also, isn't it? Susceptibility report will tell you if it is, now I classify, I will write more precisely, full susceptibility means it is susceptible, means it can be killed by all those drugs which can kill the enteric fever. That's the meaning of this here. Fully susceptible means it can be killed by all those drugs which are used for the enteric fever. So which drug will you give then if it comes that it is fully susceptible? Ciprofloxacin. Ciprofloxacin. Now I got a case. I got a carrier. Yeah, I want to tell you a carrier. How will you treat the carrier state? In the carrier, you will give ampicillin, or you can give amoxicillin plus propanacid. Amoxicillin plus propanacid. For how much? 6 weeks. For 6 weeks, guys. Is it clear? See, I did not took the vaccine part of this because vaccine part is to be learned in where? It's to be learned in the community medicine, PSM. Okay, but still I will try to tell you that that vaccines which you are giving is we have what? We have VI polysaccharide vaccine. We have typhoidal vaccine. Okay, let me write for you. Okay, vaccines for typhoid fever. Vaccines for typhoid fever. Vaccines for typhoid fever. First, I should write what? Let me write like this. Parenteral TAB vaccine. I hope you know TAB. I hope you can understand what TAB means. Yeah, don't need to explain everything, isn't it? So parenteral TAB means it's a heat-killed vaccine. It's a heat-killed whole cell typhoid or paratyphi A or paratyphi B. That's why we are calling it TAB vaccine. But we are not using it. Not using it. Why? So many side effects. So many side effects. So now going forward, parenteral VI polysaccharide. Okay, so in parenteral VI polysaccharide vaccine, what we are taking? We are taking two antigens. We are taking VI capsular antigen. VI capsular antigen. We are taking VI capsular antigen from what? S. typhi. The strain is type 2 strain. Okay, fine. It will give you protection for 2 years. This vaccine will give you protection for 2 years. Fine. And you have to give that, so that means you have to, when will you giving, when will you give this vaccine? It will be given only after 2 years in your national immunization schedule. Once the person is reaching, not person, the child is reaching 2 years of age, you will be giving this parental VI vaccine. Okay. Next type is typhoral vaccine. What? Typhoral. Typhoral means oral, live, attenuated. Do you know attenuated? Weakened. Attenuation means to weak something. We weak its antigenic capacity. We weak its virulence capacity. Then there should not be any difference. If you are giving the same bacteria with same virulence to the person, then you are infecting that person. No, you only want that part. You want only the immunogenicity. You only want the immunogenic property of that antigen to happen, not the infectious part to happen. That is what is the principle of vaccines. You only want it to be immunogenic, to produce a response in your body so that the body knows once this type of antigen I face, I should have to kill it by this mechanism. Okay. So in oral live attenuated S typhi type 21A. So it is called oral live attenuated S typhi type 21A vaccine. What is this? This is basically which strain we are using, sir. You have written TY21A. Okay. So what is the use? First, you should remember one thing. It's a live oral attenuated vaccine. Which strain is being used? Type 21A. It's only given after 6 years of age. It's only given after 6 years of age, guys. It's only given after 6 years of age. And it's an enteric coated. It is given as enteric coated capsule. It is given as enteric coated capsule. Do you know enteric coated capsule? Like you are taking it, like for example, you take any capsule, so the vaccine is like that. Okay. So this is, I think, sufficient for you to learn in microbiology of Salmonella, the important things. I hope you have enjoyed this topic. So see you all tomorrow with the next topic. Thank you and bye-bye.